assessing the airway. There are so many things that can cause us problems in anesthesia. But improper assessment is probably one of the things that gets us into the most trouble. You know, we've all gone in and thought, well, you know, this is, you know, we're really a perverse group. You know, how many of you walk down the street and go, God, I hope I don't have to intubate that patient? Walk outside. I was doing it last night. You know, and there's some patients that look exceedingly, boy, that's going to be an easy intubation. You look down there and all you see is pink and froth. A lot of guts. Now, I do a difficult airway seminar, and I was doing it a couple months ago, and there was a student. I was talking with some of the older CRNAs. We were talking during a break, and this student was standing there. She was actually about 3 weeks from graduation, getting ready. She's going to go out and be a sole nurse anesthetist at a small rural community. And she said, I don't know what the big deal is. There's not an airway born. I can't intubate. And we all were just kind of stunned and shocked and just kind of sat there in our disbelief of this. Now, blocking these is relatively easy. We really don't have to stick a needle in any patient to block, to provide pretty good relaxation of these nerves. Using a nebulizer with 4 cc's of 4% lidocaine and having the patient sit up and breathing, closing their nose off and breathing in through their mouth. You can get all the way coverage down to the 12th point, the one that Dr. Ellis and I are firm believers in, is finding the cricothyroid membrane. That's our emergency airway access point. If we do a surgical airway, it's a cricothyrotomy. Now, the time to try to find the cricothyroid membrane is not when the saturation is 60. It's when the saturation is 100. No problem, right? Except on an obese female. Obese females are very difficult because they don't have this nice Adam's apple that's a good landmark for me. Thank goodness. I'm glad my wife doesn't have one. But, man, it's very easy to find it because you find that thyroid prominence and you slide down. The first depression below, that's the cricothyroid membrane. You don't have that advantage on women. And if you have difficulty finding it, then put a dot there. Just take an ink pen and put a dot to the lateral border.